Hi, everyone. Welcome back to the Lights Too Bright pod. For those of you who are returning, I hope you are liking, sharing, and following. For those of you who are here for the first time, please do like, share, and follow, and check out some of the great stories that I've had the honor to host. Today's guest is, as I say, always a colleague and a friend who I've been fortunate enough to work with, lecture with, have fun with on multiple occasions because we share some mutual interests. She has a fascinating interest in certain things. And I think for those of you who know her, a lot of this won't be new, but I've learned something already and we haven't even started the pod. So I'm not going to waste too long mumbling along. I would like to introduce my guest today, Miss Sarah Farrant. Hi, Sarah.
Hey, Kaya. Hello.
Thank you for coming on and taking time from your kids' parents' evenings and things like that to share your journey with me. So for those few people, I guess, who don't know you, what do you do at the moment? What is your current role?
Okay, well, I'm an optometrist. That's the core of my role, obviously, what I love doing. So I'm in clinic 3 days a week. I have a private practice, which I share with my husband, Ed. And then I spend a kind of cherished admin day a week. So a whole day where I'm not in clinic, but I'm working on the business, or I'm working on lecturing, or, article writing, all that kind of stuff. And then I have a further day a week, which is me day. So that's my day off, my headspace day, and the day that I look after myself. So alongside the clinic and the practice, I have quite a few varied roles. So I'm the immediate past president of the British Contact Lens Association, the BCLA. I also am the UK ambassador for the Tear Film and Ocular Surface Society, TFOS, and then have many roles in terms of kind of consultancy with big corporate companies and lecture roles and all sorts of things thrown in the mix.
So that's great. And like I said, I've known you for a while, so I knew most of that. And I think for our audience today, I think it'd be really interesting for you to share your journey, because I think it's a lot of things that you, as an optometrist, particularly new grads, early grads, you don't realize these opportunities are available to you. And, let's have a chat and see how you got there. So to go all the way back to the beginning, Sarah, did you always want to be an optometrist? Was that your goal in life?
No. Does anyone ever say yes?
Yeah, a couple of people
okay,
have.
Fair enough. Okay, so no.
Not me.
I mean, I never had visual issues as a kid, so there was no kind of inspiration in some of those sort of traditional channels. But essentially, I knew I wanted to do something with people. I wanted to get the reward of helping and supporting people. That's kind of at the core of what I wanted to be. For a while, I did think about being a forensic pathologist and working with dead people to work out, obviously, what happened. And then that kind of faded away. And then I thought long and hard about the usual, medicine, dentistry, optometry, and kind of felt like I really wanted autonomy in my role. So even then, I kind of knew that I didn't really want to be beholden to a kind of traditional career and the NHS saying, okay, well, we've got a post in Liverpool, go and live there for 5 years, or, so I wanted something where I had autonomy to kind of do what I wanted when I wanted. And so I liked the idea of at some point potentially being my own boss. So
Right.
It was more directed to kind of towards teeth or eyes for that very reason. And then I did some work experience in a dentist and just saw lots and lots of smelly mouths. And I was like, sure, I really want to do this. And you're trying to develop rapport with the patients and they can't answer back because you're just dealing with their mouth. So that's kind of how optometry sort of, I guess, fell into my lap. And I loved science at school, and it just felt like a very logical use of kind of, being with people, the medicine side of it, the science side of it, and the autonomy to potentially kind of develop my career how I wanted it to go. So that was the origins. So university at Cardiff, where Ed and I met on the first day of Freshers Week. He threw a bowling ball at me. So there we go, top tip. So that was quite funny. And then
That get you in trouble now.
yeah. So just after university and pre-reg year, I did with the Boots. They had a big training program that they were running at the time, and then worked in practice for about 6 months, and then thought, right, this is where the adventure starts. Ed and I took ourselves off to New Zealand. We went and lived in New Zealand for about a year, and we practiced over there as optometrists, and had loads of fun adventures, both in just seeing how the profession was working over there as well. Obviously, we're new in our career as well, so it helped shape kind of who we wanted to be as professionals, as well as kind of, you know, having really fun kind of outdoor social life and lots of biking and hiking and all that sort of stuff that you could do out there. So then when we came back,
I'm going to slow you down. I'm going to slow you down. You're going too quick. You're going too quick.
Okay,
You're not giving me a chance. I know I said we were going to aim for 30 minutes, but I wasn't really expecting it. That was just like a rough, not let's pile through it in the first 6. So where is home? So actually, just out of curiosity, where is home? Where did you grow up?
Okay, so origins of home are Coventry.
Okay.
So that's
so
where
not far from us.
Yeah, absolutely.
Okay.
So yeah, and basically because Edward was from Somerset, and so after graduating, we both found pre-regs kind of in Edward's kind of, you know, hometown kind of thing.
Okay.
In Somerset, and so that's why we ended up here to start with, and then obviously did our year away in New Zealand, and then came back to Somerset and decided this was a nice kind of place to be.
While you were in New Zealand at that time, were they kind of heading down the therapeutics way, or were they still at the point where, you know, there was a period of time where Australia and New Zealand were almost considered slightly behind the UK in terms of delivering optometry to their patients? And now I feel it's gone the other way, particularly within therapeutics. They've kind of leapfrogged us a little bit in terms of their ability to deliver therapeutics. So when you were there, was this pre-therapeutics? Or were they kind of...
I am that old. So it was all the way back in 2004. So yeah, so it was, I really am. So it was, it kind of predated all of that movement. So yeah, there wasn't any kind of, there was kind of whispers, you know, like there were in UK optometry for a lot of years before we properly got that momentum. But there wasn't any therapeutic, opportunity out there at that point.
Okay. So then, you know, you said it helped you develop your career or career choices. So what did it give you? Kind of, like, I get the outdoor stuff and the lifestyle element of it. But was it lifestyle element or clinical practice element, or I don't know, a bit of both?
Definitely both. So when I was out there, there was a group of practices called Physique, and they were kind of small corporate kind of thing, you know, and they had individual owners and kind of, you know, franchise type setup. And it was just, did a lot of learning because, you know, when you're kind of, you know, fairly fresh faced and you're really passionate and you're like, right, how am I going to mold my career? You need those supporting kind of colleagues to kind of steal ideas from and get inspiration from, and kind of to just get a sense of, well, how did you do this? How have you worked out this pathway? Because I want to be on it and do something like it. And it's hard because you can't be what you can't see, you know. And I think having that understanding and the opportunity just to chat with people and kind of go, this is cool. And they're doing this in this part of the world, and I reckon I can use some of these ideas and the passion that people have and just start to shape what we wanted to do. We never wanted to stay out there. It was always just a kind of, let's do it for a year, have a load of fun, come back to the family and come back home and have the adventure over here.
Nice. And I've said this on other pods. I would strongly recommend to anyone, if you get the opportunity to live abroad, go do it. 1 year, 3 years, 6 months. Absolute, you know, even, so I was chatting to Nick about it, Rumney. And I was like, it doesn't matter whether it's a different English speaking country or a different country where they speak a different language and you have to learn it. The experience you get, the people you meet, seeing how different people live, seeing different people's perspective on life is really, it's really good for your own personal development. I think it kind of really helps you shape where you want to be. And also I think appreciate what you have, you know, because sometimes you're thinking again, the grass must be greener. And you go, actually, it's not necessarily greener, but I can...
The grass was greener in New Zealand, actually.
A lot
of
because of all the rain. It's all the rain. It's the one place that rains more than here, isn't it? So, but yeah, I think that is fascinating. And again, like I've learned something new. I didn't know you. Well, I didn't know Ed had launched a bowling ball at you. But I also didn't know that you'd spent time abroad. So then I think the other thing is that then also brings in like you get these lifelong friends that you kind of like, well, let's go to a conference. Oh, I've not seen, for years, and people that you wouldn't normally meet on a day-to-day basis. So
Yeah.
that's amazing. So you came back, and then you came back and you went straight into private practice, or you guys worked, or what did you do?
Yeah. So we came back and we kind of agreed a plan, and we said, okay, well, let's aim to have our own practice within 2 years. So that was our kind of, desire to at least have a strategy. So be in a practice that we were going to take on, or have a plan. So we both ended up, so I was doing some locum work, ended up back at his practice that he'd pre-regged with, which was Turner's in Bridgewater, with Richard Llewellyn. And then a new opportunity came up for me to work there too. So we both worked there for a few years, a couple of years. We learned a lot from Richard in that time.
Yeah.
And that was one of the kind of times where he kind of said, well, have you thought about the politics of the profession, and how you can look at those kind of avenues and maybe use some of your passion? Because clearly even then I was like, right, what am I going to do? What am I going to do in the world of optometry? So he really introduced me to the notion of getting more involved and actually having a worthy voice within the kind of the politics and the kind of future planning of the profession, I guess.
Yeah. And so you did that by what, LOC? Were you guys LOC?
Initially, so I joined the LOC in Somerset, and then Richard was on the college at the time, on the council. So then I joined the college council in 2007, and I became their youngest ever trustee. I'm sure that accolade has long since been beaten, but at the point, and that was in 2008. So I was a trustee for a good few years on the college. And then alongside that, I ended up becoming eventually the chair of Somerset LOC. And so I could kind of bring local perspectives and hear lots and lots of local voices and local ideas, and then also bring that on a national scale. And that was quite a nice harmony of looking at what was aligning between those two, but what was also so different about how things were nationally done versus the local challenges that we had as well.
And so you're doing this whilst locuming, or were you kind of full time now?
So I was locuming for a bit, and then I became a employed optom there. And then gradually so a new opportunity came up then for Ed and I to take on a practice, an independent practice in Taunton, because they were looking to retire. And so we thought, this is really interesting. So we started locuming for Earlham and Christopher, and then took on the practice. It was a perfect opportunity for us. It was kind of big enough that we thought we could, we had, if you like, enough work for 2 optoms. Yeah. So it wasn't like a really small independent. So we thought, actually, we can make a go of this. And we liked Taunton, and so we took it on, and it was scary, and our house was the backup plan, and if all went wrong we were going to lose our house and all of that, and you just take the leap, and it is big and scary, but we knew it was what we wanted to do, and we'd always kind of had that plan. So we ended up buying into it in a little bit kind of after our original planned timeline, which I think was just a bit too extreme. But we bought into it in 2010, and then that's when we kind of had full ownership of the practice from there on in. Yeah, so 16 whole years ago.
Flies, doesn't it?
My gosh, it really does.
It's crazy. And so I mean, I know this is a Sarah Farrant pod, but when did so just because I know Ed as well. So whilst you guys were predominantly in practice, were you guys both there same time, or because I know Ed does the hospital work, were you then kind of doing, right, well, I'll do a bit of this while you do a bit of that, and
it was kind of more that,
a bit.
So Ed 2 days at Musgrave, so he well, at the time he was at Bristol with Paul Spry, so he helped Paul kind of do a lot of the early work in the optometry-led glaucoma clinics and the optometry-led kind of A&E clinics that they were working on in Bristol. So he was quite involved in enjoying that. And then, there was a lot of time where like we would like tag teaming and not really seeing each other in the clinics. And people were like, how can you work together? And I'm like, I don't even see him, even if he's in the building. And so yeah. And even to this day, there's only kind of one day a week where we're actually in clinic together, where we overlap. So, yeah.
So you've got a lot going on. You've got the practice. You're doing LOC stuff. How did you then, and you're doing college, you're a trustee, youngest trustee ever of the college. How do you...
I'm sure it's been beaten now. Put that caveat in there.
What do you then do? How do you then sort of diversify beyond that, right? You're already doing a lot. What gets you into... So what came first, like BCLA or lecturing or dry eye? What, because you're probably, in terms of optometry, like the highest decorated dry eye person in the country that I know, from the fact that you're a TFOS ambassador, and that, that gives you global status, right? How do you kind of fall into those paths? Or was it just kind of a mix and match of this happened and then that happened? Did you have to put yourself out there, or were people coming to you and going, you know what, Sarah, we know you're on the college, we know you're on the LOC, will you do a CPD for us? And do you know how it is? You snowball. Someone asks you one thing.
Yeah. So, I mean, I would love to say that I had a perfectly outlined plan in my head and I knew exactly what I wanted to do, but clearly I didn't, right? Basically, if we wind back a little bit, so university, I had dry eye myself and was like, oh my gosh, this is awful, 3 a.m. and trying to work on a computer and whatever, and just going, no, this isn't fun. And then started to get like a bit interested in that. And my third year project was on the cornea. And I was just like, oh, okay, this is quite an interesting niche. And then I was like, this is really common and we really don't have adequate solutions, because we're still talking a lot of years ago, right? So that frustrated me. And because I was able to kind of have empathy with patients, I was like, okay, this could become my thing, And I kind of just had an inkling that becoming a specialist, becoming like an expert in a niche felt like the right thing to do, And, I looked at people that had niched contact lenses and niched kind of, there are quite a lot of dentists in Ed's family, and like they'd gone, right, I'm a root canal specialist. And I'm like, okay, maybe specialist work is really where like the fun is at. And so it just sort of, I kind of fell into it in that sense, that I just thought, I've got a passion for this, and it's annoying that we can't fix these people, and I want to help them. And so that's kind of how the dry eye thing was really born. And then I think with Richard's backing at the time in Turner's, I think I probably launched the first UK of its kind optometry dry eye clinic that was like a proper dedicated, we are doing dry eye, back in about 2005, guessing 6 maybe.
Yeah.
So, I mean, at that point, it was like super basic, we were like, this is a hot compress. Like that was, here's an eye drop, and there was very little, but the fact that I was doing it as a specialist clinic, I saw the difference in my patients. I saw them suddenly not just coming back going, yeah, that thing you told me to do at the end of your eye test 2 years ago, I didn't bother doing it. Suddenly I was like, you know what, even this basic care, we're getting people coming back every 4, 5, 6 months, and they're doing it. And even just those simple things, they're feeling a bit better. And I was like, right, yes, this can be a thing. And then just started developing, like reading. That's where I kind of really got into the reading published research, because at uni you're like, oh, God, I've got to read all this research and I don't really know how to interpret it. And like, oh, really, I'm not an academic. What am I doing? And then you kind of go, actually, it's really valuable. This is where the future is. This is, textbooks are old news. Let's face it. That's all stuff that's kind of been found out about years ago. What I want to know is what's going on right now. And so that's where I started to kind of get interested in the academia and the research and the papers. And like, I'm no expert, I'm no statistician. I'm not, so
Yeah.
But you read enough of them and you get a sense of what's a good quality paper and that kind of thing. And so that just kind of then got my interest. And then I started to chat with a couple of other companies. At the time, I knew the one of the Alcon reps had built up a rapport. And then I was doing IP because I was one of the first in the UK to do that. And then it was kind of like, he was like, "Oh, we're doing this kind of little lecture thing. There's this little event. It's called the NCC. There are not that many people there." And we'd like to invite you to come along, give a little lecture on, the state of prescribing and AS in the UK and what you're doing and that kind of thing.
Yeah.
And I was like, okay, I'll do that. I'll come along, having never heard of the NCC, And then I turn up and he'd said to me, "Oh, there'll be about 50 people there." And I arrived and then he was like, "No, I meant 50 people from Alcon." And I was like, Thanks, Howard. That's great. So my first ever lecture was in front of about 1,000 people at NCC in 2008. And so the night before I didn't sleep and I was like, how can I do this? I've never been on stage before. I've never spoken. And I was absolutely petrified. And then I thought, make or break, sir. Just get on with it. Just have a go. You're here. You can't not do it. So I just did the best I could. And I'm sure it was probably pretty terrible. But then, I had Lyndon Jones came up to me afterwards and I was like, oh my God, that's Lyndon Jones. And he was like, that was great. And I was like, oh my gosh, and it was so lovely to get a few people come out and say, you did really well. That was really good and interesting. And thank you. And that was, the rest is history. And after that, I thought, okay, nothing can ever be that bad again.
Yeah.
I will never be standing up for the first time on a stage with 1,000 people. So that kind of made me think, gosh, I managed to do that. And it was really scary, but I did it anyway. And that kind of made me go, yeah, I really enjoyed that. I enjoyed the challenge of that.
That's
So,
nice.
yeah.
I mean, and your delivery now is fantastic. Whenever I see you lecture, I always enjoy it because I know it's going to be your take on delivering content is you deliver it in a way that not many people will see it coming. So not only is it useful, it's also entertaining. And sometimes what's really good about that, I find, because I lean into the entertaining as much as I can, is that sometimes that's when there'll be stuff that and someone will deliver it in a way that just clicks and you think, shit, I knew that, but it hasn't clicked. Now it makes more sense. And now I'm going to remember it again. And, at Sight Club, I was worried for everyone who came after you because I thought, no, that people are going to struggle to match that. That delivery was very, very good. Okay. So, and I mean, it's interesting that it was, I think we find that sometimes, particularly within our industry, like BDM, professional services rep, whatever the term is that some of our colleagues don't really take the time to interact with them. For me, it was the same kind of thing. I'm pretty certain it was someone who was a professional services who happened to take an interest in me and then went, well, actually, we've got this thing. I can't remember what it was. Would you be interested in doing it? And I think it's really important. I mean, the whole industry is about, it's a very small industry. So you got to watch which bridges you burn and how you burn them. But because it is so small and so friendly, if you make relationships and make friendships, it's so important to career development. So I think some of these people who either choose not to or don't get the opportunity to meet with their local providers of product, because it is product, I think that they don't understand that. I don't think they'll get what they're missing out on and the opportunities they miss out on.
And I think the other thing that I think is such a shame in a way now is, because a lot of our learning can happen online. And because, we can sit with a cup of coffee and watch a webinar and get the CPD, great. You've done the academic bit, fine, tick the box. But then you don't get the, oh, hi, I'm Sarah, nice to meet you. All that wonderful over coffee chat that you have at meetings like the BCLA. And I think that's where you make those links, where you kind of have those chats with people and, oh, you're in this part of the world. Oh, you're doing this. Oh, what do you think about that? That's where the real learning happens so often, when you get these little nuggets and build up this community of people that you get to know and get to like, and you can use them as mentors, and they then go, a person that we met would be great to bring on
Yeah.
board and have them work with us on and I think there's so much value in that kind of soft, quiet networking that you and I do for a pastime. But actually, my worry is that maybe is there's less opportunities to do that these days because
I'm no, go on.
you know,
I'll let you finish. I was
no,
going to say. I mean,
because
I think. Go
no,
on, say it. Finish.
I just worry that, people don't embrace the idea quite in the way that they used to, of thinking that, yeah, my membership of the BCLA is vital, my membership of the college is vital, because it's about belonging and being part of a community that has this shared passion. And, I want to see that bloom again, because I think it's vital that we can learn from each other.
Yeah, I was going to say. I mean, to your point, I think the opportunity is there, but I don't think people appreciate it. Having done my time in the US, I don't think we emphasize to our students enough the benefits of going to conferences. So, the BCLA, I can shamelessly plug it. This is my pod. I can talk about, whatever I want. But the BCLA is a fantastic conference. All right. If you have an interest in, you know, primarily contact lenses, but now more dry eye anterior seg, why would you not want to be there? Next year, big one, 50 years, gonna have it's gonna be a great conference. But if you don't go, you won't appreciate what you can get from it. And I don't think our students get that. Whereas the US students and the Canadian students are always told, oh, go to the American Academy meeting, go to the American Optometry Association meeting. And it's very much kind of drilled into them in a sense of, if you really want intellectual and professional development, this is where you're going to be getting the latest information. Because to a point you made earlier, books are already dated by the time they're in print, right? That's why no one buys books anymore. Just Google will give you the latest information. PubMed will give you the latest information before it's reached print format. But if you want to meet the people who are creating that, who are at the cutting edge, conferences is where you want to be to really to learn it first, but also to discuss it. The point you made about that soft learning, and a point you made earlier about seeing people in different places and going, well, actually, I want to be where you are. Would you mind sharing how you got there? Would you mind sharing your thoughts about implementing this technology and how you've managed to do it? Because for the most part, unless you go and talk to the person who has a competing practice across the road from you, most of our colleagues are like, yeah, this is how we did it. This is what works for us. If you need any further help, or if you want to come and see me in practice, come in. Good luck. Because I think I think we're a friendly profession, and I think we want to see our peers develop, and we want to see the profession offering more and more, being able to offer more and more.
Yeah. And it's, let's not reinvent the wheel here. I mean, to talk about the BCLA again. So my presidential address was all about kind of standing on the shoulders of giants. Okay. So learning from others, learning from the past, and using that incredible, enormous history that is behind the whole world, but particularly in the world of eyes, where if you've done something and you've failed 20 times, you can teach me. The failures are almost more important than your successes, right? Because you learn far more from them, right? And so I can go, oh, okay, so Kaya tried that, it didn't work. So I'm not going to try that, because I know that hasn't worked in that way. We can help each other, we can lift each other up, and all kind of help, elevate all of what we're doing. But you can only do that if you've got a relationship with someone, and you can't get that from a webinar. So I think nurturing that is so vital.
And while we're giving shout out, I will also shout out NCC, which is another great conference in the Netherlands. They alternate with the BCLA. They are January, February time. Usually BCLA's usually summertime. But another great opportunity to meet colleagues who sometimes you think our European colleagues can't do some things as well as we do, like the therapeutics because of restrictions on their practice. But boy, some of the things they do that we've almost forgotten about because we just don't do it as much. Gas permeable fitting and things like that, where I'm just like, well, I'm just going to speak to professional services and ask them to manage this for me. And they're sitting there designing their own lenses. It is really, really inspiring. It makes you want to go, well, actually, you know what? Maybe I should stop watching Netflix and actually pick up a book again to get there.
But that's the thing, passion, it's addictive, isn't it? And you listen to someone talking about some cool, interesting thing that and you can't help but imbibe some of that passion and think, oh, wow, look at what they're doing. Isn't that cool? And I think we can learn so much from each other. And huge way of doing that is using your network, building a network, and then using it, asking questions and not being afraid that you'll look a fool, because you never do.
There's and this sounds a bit mean, but it's true. There's always someone who's stupider than you are. So embrace it. And hope they're in the room when you ask your question.
Absolutely. On that point, I mean, I definitely used to, and even now occasionally, get this kind of proper imposter syndrome thing where, I'd be like, well, why am I here? Who am I to talk to all these people in front of me? What have I got to bring to the room in front of all this, amazing audience? But actually, I think the key thing is being true to yourself and saying, well, I'm not trying to be some top academic person. I'm just a clinician, and I say that, I'm meeting I'm on the coalface, I'm doing the job day to day. And then you suddenly go, actually, there's value in that, because there's lots of clinicians that we can share thoughts on and we can get ideas out there. So I think it's important to be true to yourself, find your passion, and then use the leverage of other people's hard work to bounce from and learn from and develop your own path on.
So I think I'm going to move on after this, but I think the thing that I've learned, or that I've more recently I've just come to terms with, I'm like, if someone's asked me, they think I can do it. So that, like, my self-doubt about whether I can do it or not, I've got to overcome that. But if someone's asked me, for whatever reason, they think I can deliver. So my job is then to deliver the way I deliver. And well, if it doesn't work, they won't invite me back, as I said earlier. But hopefully it does work. And I can't be that bad, because every once in a while someone does ask me to talk. How did you get involved with the BCLA? Because at the time it was predominantly contact lenses. Were you thinking of going down speciality contact lens route? Because that's what it's thought of, right?
Don't get me wrong, like, I still do a lot of contact lens work, and we had loads of hospital work in the practice already, and primarily more kind of RGPs rather than sclerals and things. But Ed kind of was the big kind of contact lens is going to be my niche thing, So and we didn't want to clearly specialize in the same thing, because that didn't make sense in a practice, So he kind of did all the Ortho-K training and the scleral stuff, and but clearly you can't put a lens on a rubbish ocular surface, right? It doesn't work, no matter how good your fitting is, no matter how amazing your lens is. And so it was clearly there so many links, and I thought that, again, the college was very kind of broad based for me, and I learned a lot, and the politics and the engagement was really fun, and again, lots of network building there. And then my college, so I served my whole 12 years on the college and then got kicked off. And then immediately, like, seamlessly rocked into the BC. And Ed was like, oh my goodness, can you not have a break? But I didn't want to. And it was fun. I thought, right, okay, well, what can I bring from my college learning and from my practice and from my passion with ocular surface to the BCLA? And I thought, well, actually quite a lot, So it seemed like a very logical kind of route for me to go down after my college days.
Yeah. How long were you? So you're still BCLA, but it's sort of exit strategy BCLA now, isn't it? Post president.
Yeah, I'm being kicked out now. So I joined the BCLA in 2018. On the council initially, and then I after a few years on council, I joined the executive board, and then obviously did my presidential year last year. And then I'm currently the immediate past president, so get to be in that role a wee while longer, and then gradually, sort of transitioning out as the new blood comes in, as it were, and quite rightly, So yeah, it's been a fun ride. Yeah.
Yeah. And then when did TFOS come about? Or how
So
did TFOS come about?
So that came about way back when I was kind of a bit on the circuit and talking and sharing my own experience about dry eye and kind of saying, well, look, this is how I set up the clinics and this is what I've been doing. And by then, so I'd been lecturing for about 8-9 years or so. Not a lot, just little bits and helping with workshops, and pretty much mostly UK based. And then I got approached. I got telephoned by Dave Sullivan, who said, "Right, your name's been put forward for the UK role." So obviously that was a huge honour, and definitely couldn't say no to that. So
that's fantastic. I mean, for those of you who don't know, TFOS is the Tear Film Ocular Surface Society, and I mean, I could probably say this with I think being pretty accurate. It's probably the most up to date dry eye society, cutting edge in terms of advice, management, research. Every couple of years, they will create what usually becomes the gold standard in dry eye management and diagnostics papers. And they're now on TFOS Choose 3, which is a significant body of work. And as we learn more about dry eye and what causes it and how to manage it, and more treatments come out, it's a great resource for those of you who are interested in that particular field.
Yeah.
To your point, Sarah, about contact lenses and dry eye sort of going hand in hand, you're right. You can't be, in my opinion, right? My opinion. So there might be people who don't agree with this, but you can't be an elite level independent. And I say that it's important to be independent, elite level independent contact lens practitioner if you can't manage ocular surface disease, because it rears its head, but also if you don't have therapeutics. So IP, if you have IP, that opens so many doors. And if you want to be a contact lens specialist, you really need to have your head screwed on when it comes to dry eye. But from a business perspective, it allows you to come at two separate fields with a lot of stuff that overlaps, just in terms of technical equipment, skill set. And I mean, that's my opinion. I'm sure there's people who don't have IP and they'll probably be like, no, you can. I'm not saying you can't be a great contact lens fitter, but I think if you want to be that independent person who can do it all, you really want that less likely to have to refer out. If you can do dry eye management, if you can do IP, you keep everything in-house.
Yeah.
And there's a lot more career satisfaction in that for me.
Absolutely. And I guess my view might be a little bit controversial on this, but what I find now, with loads and loads of dry eye clinics popping up, which is awesome. I love the fact that people are getting more and more passionate about it and recognizing the importance of treating it and treating it properly. But my concern is that there are many people that say, I'm a dry eye expert. I don't even call myself an expert because I think I'm learning all the time, right? I'll call myself a specialist, but, that's for another day. But I think the danger is, if you call yourself a dry eye expert and you don't have IP, I think there is a deficit there. If you can't then give someone softer core, prescribe, management strategies and, Sulantra and, just simple stuff, even if you're not going down the iCurvis route and the cyclosporin route, to not be able to give a dry eye patient some sort of therapeutic agent like a simple steroid, I would argue that you can't really be claiming a dry eye expert level, and all I would say is, get IP, because that alone should be the driver to make you go, right, I need IP. IP is going to open up so many more avenues of actually managing the inflammation, managing the infestation, just operating at a much higher, more effective level. So, and I know there's probably people that would argue against that, but I don't like the fact that dry eye expert gets thrown around a lot with people that don't really have the qualifications to manage a dry eye because they haven't got IP.
Yeah, no, and I agree with you. I also worry a little bit about devices like IPL, which are great, but you have people using them who maybe don't do the basics first. and the first port of call is IPL, and you're like, you've not looked at the root cause, and you've just thrown IPL at it, which is great. Don't get me wrong, I love IPL and low level light. I'm getting it myself because you've seen my glands, the absolute state. So I do it, but I do sometimes sit and think, oh my God, loads of people buying IPLs, but are they doing the groundwork before they start throwing people into IPL?
Well, let's face it, Care, anyone can buy a bit of kit, but you've got to have the skill to recognize the patients that need the kit and the skill to use the kit and then interpret what the kit is achieving for that patient. And that's the challenge of getting the experience where you can then learn the nuances of where this is appropriate, where you need to start with this therapy first or that therapy. And that's the risk, I guess, where people just go, we can just buy this fancy bit of kit and charge loads of money and fix dry eye.
Yeah.
And it isn't that straightforward. You've got to do a proper workup. You can't do that in an eye test. You've got to look at the glands, understand the glands. You have got to squeeze the glands. Can I just make that clear? So for goodness sake, you can't assess a gland without expression. And I feel so strongly about that. It drives me bonkers how so many patients come to me for the first time and they've gone like, oh yeah, I've been to see 15 dry eye experts here, wherever, clearly none of my super friends because they all squeeze, but
You don't have to lie. You don't have to lie to me. I wouldn't be surprised, Sarah, if one or two of mine, after they visited everyone else, ended up in your neck of the woods.
Right, we've all got them. But they're like, oh, and I've been to Moorfields 12 times, and I've been to this hospital and that hospital. And okay, well, when did you last have your glands expressed? And they're like, sorry, what? And I'm like, the painful bit where they squeeze. And they're like, no one's ever done that to me. And you're like, my gosh. How can anyone actually have diagnosed your dry eye disease when you've never been squeezed? And it really irks me, and that's why I'm going to do my little plug for Specialised Ophthalmic Services, which is our little company that started off in Somerset LOC because there was a need for gadgets because optoms didn't know where to get them, and so we kind of have a range of things like reusable forceps and disposable forceps and all the stuff you need to do acute clinics and dry eye clinics. So there's my little plug.
I'll stick a link into the bottom of the post as well.
Fab.
Sarah. So, but I'm glad you mentioned it because you're right. People don't know. And then you end up down this rabbit hole of Google and eBay and Amazon, and you're not actually sure what you're getting, where it's coming from, whether it's actually designed to be a reusable tool or not, and how to clean it, what to do to clean it. And I know that within SOS, you've got all of that. Those services are within there. So I'll stick a link somewhere within the body of the text to do that. That's fine. And here we are. We're at 50 minutes. We are back to Sarah Farrant, business owner, dry eye guru, first past president, BCLA, president of the BCLA. So now you're being kicked off all the committees. What committee are you going to go for now?
Oh, well, who knows? No, I think I've really loved my time on the BCLA. And I've loved my time in the college. And I feel like I've been able to contribute and I've had a voice and people are willing to listen. And that's been a really fun journey. And I've really enjoyed what I hopefully have contributed to the profession as a consequence of those roles. And the thing is, I think the key thing that I've always kind of lived by is within reason, try to say yes. Don't shut the doors before they've really opened, because you don't know where these opportunities are going to take you. And obviously, you've got to balance that against family and personal life and having me time and, but I think that you never know where if I say yes to that and then I'll meet this person there and who knows, and it's just, that's just how it flows, isn't it? So I think for me, I don't have a super clear, this is exactly how the next 10 years of my life are going to play out. But that's what I kind of love as well, is that it's like the adventure of unfurling where things are going. And if something piques my passion and my interest, I'm like, oh, there's a new gadget that does this. I want to learn about that, and instead of just reading an article about it and going, oh, well, that was interesting and passing me by, I'll read the article and go, right, where's the email of that woman that wrote that article? I'm going to email them. Tell me about this. What's the, and then you suddenly open up this new avenue. And that's the adventure. And it genuinely is super fun. And I love the challenges that brings of like understanding new ideas. And then, one of the skills is being able to then kind of take that information and then through the lecturing kind of go, right, guys, there's this really cool stuff. Did you know that this means that? And being able to share those kind of complex kind of academic ideas into those bite-sized things that actually means something in clinic. And I love that part of the adventure as well is kind of learning for me first, but then if I learn it enough that I can teach it, I must have a pretty good understanding of it.
Yeah, that is fantastic. Right. So you've just been dropping little nuggets all the way through it, which has been fantastic. Because obviously you've watched all of these, Sarah, and you know the flow of these. What I like to do before we kind of say goodbye, and I thank you again, it's if you had to give one piece of advice, right? If you had to pick of all these nuggets that you've dropped in this episode, one piece of advice to a newly qualified or a professional about anything. Career, life, can be anything. What one piece of advice would you kind of give this young person? One of your children.
Gosh.
What would you say to one of your kids?
I think...
No, don't say that because that's always different. Kid stuff is always biased. Your own kid stuff is always biased. It's always got a tinge to it.
I honestly think follow your passion. Try and find your niche, whatever that niche is. I think in my kind of humble experience in the world of optometry, the practitioners that are the really successful, really kind of amazing people that you want to hang out with are the ones that have got a passion, but they've not just gone, no, that's not going to work. I'm just going to, follow this path. They've gone, no, this is what I want to do and where I want to be. And they've not known how to do it, but they've just used opportunities, put themselves forward, even if that felt quite unnerving and unsettling, but just said yes to stuff. And that's probably too many things. But yeah, the crux of it is, I think, believe in yourself and your adventure awaits. Doors are open. You've just got to find the right one to push on.
That's perfect. Before you say anything else and ruin it, Sarah, I'm going to cut you off there.
Oh, thanks,
That was perfect. In the edit, that's going to be amazing. You don't even know. Right. So I would like to thank you so much for taking the time. It is always lovely to chat to you. I will definitely drop in a link at the bottom for the SOS because it is a really good tool. Again, shameless plug because I'm on membership committee, as you know, for BCLA. Check it out. Even if you just come to the conference, see what's it about. And if that doesn't want to be a member, doesn't make you want to be a member or make you, ignite some passion in you for contact lenses or anterior seg or dry eye, then I don't think anything will. So thank you very much. Have a lovely evening. And I will let you go to your pottery studio to make my 50 mugs, please.
You're welcome, Kate.